Reflection is a fundamental principle that is used to assist health professionals in professional development and practice. As a junior clinician, reflection is a critical core competency when learning new skills and developing knowledge. It is also vital in relation to registration standards as a practicing paramedic. This assessment will utilise 6 phases outlined by the BAS model of reflection as a framework to reflect on my personal practice, treatment actions, as well as critically discuss and evaluate my learning experience. In a recent clinical simulation, I was called to a patient who was not coping after the birth of her child. I was given limited information regarding her current health status. On arrival, I was met by the patient's brother, who informed me that the patient had locked herself in the bathroom and was refusing to seek medical assistance. I quickly realised that I was dealing with a psychosis scenario. Initially, I felt rather anxious about dealing with a mental health scenario, as it takes skill to build rapport and assess a patient suffering from an acute episode of psychosis, and it is a skill I still lack as a junior clinician. Upon reflection, I understand that feeling anxious and apprehensive was a normal reaction and was a natural response to a high-stress environment. I acknowledged these emotions and used them to my advantage to ensure a timely and structured approach to the scenario. As I was unable to assess the patient, I felt a sense of urgency and pressure to assess my patient, as it is unnatural as a paramedic not to be able to visualize your patient. My initial thoughts were that I needed to ensure scene safety, assess the situation, and identify if the patient was conscious and breathing. Throughout the experience, my emotions and feelings fluctuated, but as I began conversing with my patient through the door, I was able to intertwine my mental health assessment and clinical knowledge, which led to informed and timely decisions. I wanted to gain access to the patient in order to assess them. However, I quickly worked out that I was not going to be able to access the patient without building trust and rapport. While I began to converse with the patient through a locked door, I reminded myself about the importance of keeping an open mind. This self-awareness ensured that I set aside any preconceived notions or biases that I had in regards to the case and the patient. Once I gained access to the room and the patient was unconscious, I relied upon my training and began to treat the patient in a structured and systematic way. I kept a level head and was mindful that I wasn't going to let my feelings overwhelm my treatment. I did this by ensuring adequate communication with my partner, early call for alpha backup, talking through interventions with my partner, and constant reassessment of my patient. Phase 1 has taught me the importance of self-awareness and acknowledging my thoughts and feelings present in the moment. I understand that as a paramedic, it is important to harness your emotions in your work, but not let them overwhelm your treatment or interventions. Meaningful reflection also helps you to be more self-aware in similar situations, which fosters growth in young clinicians. In Phase 2, the focus shifts to a detailed factual description of the clinical paramedic practice experience. This emphasizes the importance of gathering comprehensive facts to ensure a thorough understanding of the event. It cultivates skills such as observation, recall, and attention to detail, with a particular emphasis on identifying what was significant and why it is essential for deeper reflection. During this particular scenario, I responded to a patient suffering an acute episode of postpartum psychosis. The scenario was run during an intensive practical class at QUT and utilized my peers as actors. Upon arrival to the scene, I was met by the patient's brother, who informed me that the patient was a 30-year-old female who was 2 weeks postpartum and was not coping at home after the birth of her son. The brother stated that she was neglecting the baby, distancing herself, and saying she wanted to harm the baby. The patient had a history of depression and a family history of bipolar disorder. The brother was unsure if the patient was properly medicated. Today, she's locked herself in the bathroom and may be armed with a knife. I approached the scene with caution to find the bathroom door was locked and I was unable to visualize or make contact with the patient. I was able to introduce myself to the patient and get a response which determined that she was conscious and breathing. Due to the presenting symptoms, I knew that I was going to need access to the bathroom, so after 3 minutes of trying to build trust and rapport with the patient, I called for QPS backup to gain access. After 10 minutes of attempting to bond with the patient and gain access to the bathroom, there was a sudden bang followed by no response from the patient. Police helped us gain access, where we found the patient unconscious but breathing in GCS3. The patient had a deep 20-centimeter laceration to her left forearm that was hemorrhaging quickly. I immediately got my partner Bryce to hand me the arterial tourniquet to stop the bleeding. I was able to stop the hemorrhage and complete further assessment. I started with the assessment of the patient's airway, breathing, and circulation. The patient had a clear and patent airway, was breathing shallowly and rapidly. The patient had a carotid pulse, however did not have a radial pulse, and the pulse oximeter was unable to read the patient's oxygen saturations. I placed a non-rebreather mask on the patient at 15 liters per minute to prevent severe hypoxemia. Throughout the assessment and intervention process, I repeated the patient's vital signs every 5 minutes, gained IV access, and pushed a large bolus of 500 ml of normal saline. Communication with Bryce was essential to ensure that we were on the same page in regards to treatment. I was able to get my patient into the back of the ambulance successfully and transport rapidly to hospital. I understand the severity of the patient's condition and the details of the case, and it is crucial for deeper reflection, which allows me to explore the factors that influence my decision making and treatment options. Phases 3 and 4 focus on diving deeper into the thoughts, feelings, and actions of self and others during the simulation. These phases also encourage an exploration of the underlying values, beliefs, and morals that influence decision making and subsequent actions taken during the scenario. Both of these phases aim to explore the experience in a holistic manner, which enhances the capacity for critical reflection and the ability to refine practice. When looking at my values, beliefs, and morals, I believe that I carried a strong commitment to the patient centered care before and after accessing the patient. I tried to address the emotional well being of the patient by building trust, which guided my words and actions. I made efforts to reassure and communicate with my patient and my partner, ensuring effective and collaborative work. I believe that my ability to manage the emotional aspect of care was very valuable in this experience and provided a holistic approach to patient centered care. I was able to draw on a recent experience I had on clinical placement, which also involved a similar case. This previous experience deepened my understanding of the case and the factors that contributed to the final outcome. In Phase 5, the focus moves to critical and evaluative analysis of the scenario. This phase aims to encourage learners to objectively step back from the event and examine the events as told in Phase 2. It encourages clinicians to examine what went well and what could be improved in the future. During my evaluation, I can identify several aspects that went well. Firstly, my attempt at verbal de escalation was well done. I ensured the patient was comfortable and felt like she had a choice in her healthcare. I asked several open and closed ended questions and attempted to get a person of comfort present and told her the options that were available for her. After I gained access to the bathroom and the patient was unresponsive, I ensured my initial assessment was systematic and rapid intervention was effective in stabilizing the patient's condition. The use of the arterial tourniquet stopped the patient from sanguinating. I used fluid therapy until the patient's radial pulse returned, and the use of high flow oxygen was effective at improving the patient's oxygen saturations and preventing hypoxia. Additionally, my communication with Bryce was very effective, and this was evident in the overall treatment of the patient. I also ensured that I resourced police and a paramedic backup effectively. Upon reflection, I think that I ran the scenario well, however, there is always room for improvement. In hindsight, I would have tried swapping partners and seeing if Bryce or the brother could make a better connection with the patient through the door. This may have expedited the scenario and had a more positive outcome. I would have also provided an earlier sit rep for backup after gaining access to the scene to ensure I had the correct resources needed for treatment and extrication. I was also very concerned about reading and interpreting the core pulse that I forgot that the bleeding patient would become hypothermic very quickly. I needed to apply a warming blanket in the future to prevent further deterioration. Moving forward, I see an opportunity to improve my practice by focusing on further training and development in managing patients with acute presentations of mental health. It can enhance my competency in building rapport with patients and performing mental health assessments. I have made this my goal for my current clinical placement and have been seeing improvements in my assessments over the past 4 weeks. This shows the importance of experiential learning as a paramedicine student. Developing even stronger skills in managing the emotional aspects of patient care and effectively communicating with family members present on scene may have also been useful in the scenario. Using the brother to communicate with the patient may have had a more positive outcome. Collaborating more closely with police and possibly a mental health clinician for managing an acute presentation of postpartum psychosis could have also helped my management of the patient and minimize the end outcome. Incorporating regular debriefing with colleagues to share experiences and learn from each other will also benefit my learning in the future, as well as improve teamwork and overall communication. Phase 6 delves into the transformational learning. This phase encourages the clinician to synthesize and integrate the evidence gathered during the reflective process to identify what they have learned during the reflective process. It also allows clinicians to recognize gaps in their knowledge and form an in-depth reflection on the clinical paramedic practice experience and what they have learned about themselves and from others. Upon reflection in the scenario, I have learned several valuable lessons. I have learned the importance of having a systematic approach to all cases regardless of acuity and the ability to deliver effective and timely medical interventions. I have gained a deeper understanding of the importance of a thorough mental health assessment and how to implement this into my practice. I have also noted some changes in my perspective of mental health. I have come to appreciate the complexity of acute mental health presentations, especially in high stress situations. I have learned to view patients within the context of their unique experiences and backgrounds, understanding that their emotional well being is just as critical as their physical health, and the need for adaptable, patient centered care should always be at the forefront of treatment. I have seen the importance of experiential learning as a paramedic student and am privileged that I have been able to have so many hours of on road experience with experienced clinicians. Moving forward, I will continue to enhance my clinical competency in mental health examination by taking part in clinical practice development as a graduate paramedic. I will continue to provide holistic and patient centered care to all of my patients and contribute to positive patient interactions and outcomes. I will also strive to be a reflective practitioner who is dedicated to a lifelong learning. The transition to graduate paramedic is a privilege, and I cannot wait for the potential it holds for my personal and professional growth as a registered paramedic.